when you're setting up for the day that you're doing your Ironman, you have all your stuff set up, your bike's sitting there, and you have this, and you have that, and you have that, and then all of a sudden you look up and you're like, oh, I forgot my goggles, and you freak out. That feeling every single day today, every day.
Michelle Hughes is 59 years old and lives in Santee. She used to compete in triathlons and Ironman races. 8 months ago, she was diagnosed with early onset Alzheimer's.
Here I am now in the hardest race I've ever been in.
She spent months noticing something was off until one day at work,
It was like I never learned the skill that I had for 28 years. For the life of me, I was struggling to try to figure it out, and I just
she eventually lost her job as a cardiology clinical specialist, and with it, her health insurance.
got to balance. Okay, how long are you going to live? How much money do you have? Those are realities.
She was diagnosed at the Neuron Clinic in Chula Vista, where she now receives Leqembi infusions every 2 weeks.
Okay, Michelle, so we are going to go ahead and start the IV.
It's the first FDA-approved drug that slows the progression of early-stage Alzheimer's. She gets it through Medi-Cal, California's Medicaid program, but approval wasn't easy.
I had to go to the state of California and write up a big thing about how my life is and what happened.
Medi-Cal can cover Leqembi for those who qualify, but many don't. That's because people under 65 with a disability like Alzheimer's must wait 5 months to get Social Security disability insurance, then another 24 months before Medicare kicks in.
But we know that there are two exceptions to that rule, end-stage renal disease and ALS.
Jim Taylor leads the advocacy group Voices of Alzheimer's. He says nearly 100 patients signed a letter to Congress this year asking lawmakers to add early onset Alzheimer's to that list,
so that they can begin treatment as early as possible and as effectively as possible.
He says there's no congressional opposition so far, but it will come down to cost.
3 years worth of therapy would buy me 1 year of stability. So that's 1 year I can stay at home. That's 1 year potentially I could keep driving.
Dr. Eric Perkins is a neurologist at Sharp Health. He says early treatment is more critical for this age group.
There would be an increased sense of urgency for early onset because it does progress faster in younger people.
But the treatment costs more than $26,000 a year. The Institute for Clinical and Economic Review evaluated Leqembi's value and found it is priced too high for what it delivers. Dr. David Rind is the nonprofit's chief medical officer.
So if it keeps you out of the hospital or it keeps you out of a long-term care facility, there's monetary savings there. But there are still costs in paying for the therapy. There are costs in scans to make sure that you're not bleeding into your brain, you're not getting swelling in your brain.
He says a fair price would be between $9,000 and $21,500 per year. At that price,
this isn't an unreasonable thing for insurers to cover. It's a drug that works. It does slow the decline in Alzheimer's disease.
But he also warns
you wouldn't necessarily want to go through your life savings to modestly slow your decline in Alzheimer's disease.
Medicare estimates it will spend $3.5 billion on Leqembi this year. That could grow if younger patients gain coverage. But a 2022 University of Chicago analysis found early treatment could save the system billions by avoiding hospital and long-term care costs.
I love riding my bike.
Michelle still rides her bike, runs 6 miles every other day, and has a supplement stack that would impress any bodybuilder.
Lion's mane should be right up front. There it is. Lion's mane.
She manages her brain with a giant calendar pinned to her wall and sticky notes scattered around with scribbled reminders.
So when something is already done, I check mark it so I know that I don't have to go back and do it again.
She says she feels blessed she's able to access a medication that gives her hope, while many others are waiting.
I am not a quitter. You know, I've done all those Ironman races. Never once did I give up. I'm not pushing my body, but I am pushing my mind to live in this world with Alzheimer's. This is the only way I can, or I get lost.
Still, she's determined to stay in the race for herself and for those behind her. Heidi de Marco, KPBS News.